Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now here is your host and founder of Laser Therapy Institute, Dr. Jason Roundtree.
Hey, thanks for joining us today on Healing at the Speed of Light. This is your laser therapy podcast specifically targeted for patients. Now, if you're a healthcare provider, we also have the LTI podcast. So head over and check that out. But what we do here is we take a look at the laser therapy research that's coming out as far as it concerns you, the patient. The big focus is, of course, serving patients here at LTI and enabling practitioners to serve patients with laser therapy. And as we're going to talk about today, laser therapy has far-reaching effects and some really incredible potential for benefits for patients as a whole. So my name is Jason Roundtree. I'm a certified medical laser safety officer and a chiropractor. And this is Christy. She's the co-host. And she's been with me for many years. She's a certified laser therapy tech. And she also heads up our education program at LTI as far as course design, tech support, really pretty much everything that is actual hard work.
I guess, yeah.
Yeah, I just get to run my mouth and try and look pretty, which is already hard enough. So that's my job, and that's Christy's job. And today we're going to bring you a little bit of information about a study that was published just this year, February 2026.
Recent.
Yes.
Very recent.
Very
Nice.
recent. Actually, I was looking, just happened to look over this morning. We had over 1,200 studies published last year on laser therapy.
Wow.
The most in a year ever. So this is an accelerating, expanding field. Every year we have more and more evidence to such a degree that I can't even keep up with it. It's amazing.
So you think it might be working?
Yeah, you'd think it might be working. Yeah, exactly. But we're big believers in not just what we see in practice or what we think sounds good. We are all about what does the research say, because that's how you sort through the noise and find out what is worth your time and what is worth your money when it comes to looking at laser therapy as a possible laser therapy patient.
So true.
Yes. So the title that we're going to go with today for today's podcast is "Can Laser Cure Diabetes?" And it's a little bit of just an attention grabber because no, we can't cure diabetes at this point with laser therapy. However, this article covers a lot of different aspects of diabetes care that laser therapy can address.
Okay.
And so more than just medication management, more than just insulin treatment, there are more and more studies showing benefits for people with diabetes, the symptoms of diabetes, and the actual disease even itself.
Wow. This will be interesting.
Yeah. It's a really, I picked this study because diabetes is huge. It's growing 3 to 5% every year, which is unfortunate, but.
And sometimes you can control it with diet, but sometimes you need a little extra help.
Absolutely. Yeah, specifically like type 2 diabetes, very controllable with a healthy diet in a lot of cases, despite genetic and environmental factors. If you can do the dietary part, a ton of people need to do that, and they need to handle that. But we're also talking things like type 1 diabetes, which is something you really don't have control over with your diet. So that is something that this article does talk about, is both type 1 and type 2 diabetes. They do mention gestational diabetes, but primarily we're looking at the type 1, type 2 diabetic management. Nice. So, and just like we're saying here, this is, laser therapy, nothing we're going to talk about today. Laser therapy is not a cure for diabetes. No. It's not a complete replacement for things like good nutrition, exercise, glucose monitoring, and a medication regimen that's overseen by a provider. We're not saying you need to replace all of that with laser. That's not possible.
It's more working alongside with and enhancing and, working together.
Yeah, exactly. Because many times, like you mentioned, people have great results with nutrition, but they can still be left with continuing issues like neuropathy or diabetic retinopathy or sometimes even wounds that won't heal. And there's all those factors actually are addressed in today's episode on this study. This study is titled "Photobiomodulation and Low-Level Laser Therapy as Complementary Strategies in Diabetes Treatment." So basically what we just talked about.
Complementary.
Complementary. The big word at the beginning, photobiomodulation, is just our technical word for light therapy, right?
It just sounds cool.
It does sound cool because we're cool.
Yeah.
Yeah. So now you might just be hearing about this kind of thing for the first time and going, what are you talking about? Light therapy, laser therapy? Well, on the market, it's been often referred to as red light therapy, this photobiomodulation term, laser therapy, low-level laser therapy, cold laser, high-intensity laser, deep tissue laser. There's a bunch of different terms. Really, they all apply to the same principles, and that is using a very specific type of light to affect the way the cells function.
Right.
So we know that light can have some pretty significant impacts on cells in general, different types of light. So you'll see blue light used in hospitals for babies with jaundice. It actually helps jaundice clear up faster. You probably know that UV light helps the body generate vitamin D. That's why it's important to have vitamin D supplementation if you're not getting sun exposure.
Right.
Even though you should wear your sunscreen. It's still good to have some light exposure. And so we know that light can actually pass through the skin and can influence and affect our biology. How does this work specifically for diabetes, right? So this is only one of a couple of times that I'm going to get a little bit technical. This is a direct quote from the article, though. They say the absorption of photons, so light particles,
Right.
by cytochrome C oxidase, which is a little basically colored photoreceptor in your cells, picks up light, this specific kind of light. It triggers that process, that absorption of those photons triggers a cascade of photochemical and biochemical reactions. This includes increased adenosine triphosphate synthesis, which don't get tied up in that. That's just cellular energy.
Look at
energy.
that. Look at that later.
Yeah. Also modulation of reactive oxygen species levels and photodissociation and subsequent release of nitric oxide. Nitric oxide plays a big role, they say a crucial role, in vasodilation, meaning more blood vessel enlargement, right? Thereby enhancing blood flow and tissue oxygenation. So just to put that condensed into a little more friendly format, the right kind of light gets absorbed by the right little particles in the cell, and that causes increased cellular energy and increased blood flow by opening blood vessels more. Now, nitric oxide has a bunch of other things that it does too. It's actually a very, very critical part of cellular health. But specifically, we're talking about blood flow and tissue oxygenation here, and that is important. So they say through these interconnected pathways, laser therapy supports cellular metabolism, improves microcirculation, and promotes tissue repair.
Nice. Sometimes you need to know all that. Other times you just need to know you start the car, it works.
That's exactly right. Yes. We try on this one to provide a little bit of both.
Right. Right.
But if you just completely zoned out with that, just understand we're talking about safe light, not cutting, not burning tissues, but the right kind of light that is absorbed into the tissues and has beneficial effects on the blood flow and on energy levels. Yes. Yep. If you want to know more specifics than that, we got you. But I won't bore you with it right now.
Just email doctor.
Yeah, you might get a sermon, a whole diatribe. But we'll skip on to the more important part, which is how do you use this for diabetes, right? Well,
right.
If this is something that can be used for diabetes, what do we do? Well, first we got to understand that diabetes causes tissue damage, right? So both type 1 and type 2 diabetes, really all diabetes cases are very similar in that you've got increased levels of blood sugar and highly varying levels of blood sugar, especially for type 1 diabetics. And that's almost like having sandpaper in your blood.
Oh, wow. Hadn't heard of it that way.
I've been trying to think about a good way to describe it because it's very hard to picture like sugar. Sugar hurts me. This is like, think about, high sugars as a circulating sandpaper in your vessels.
Well, and we've heard sugar is poison.
Yeah. Yeah, it is. So. And it's more complicated. It's not straight up just a mechanical, but essentially it kind of seems like the same. So whenever your blood sugar is high, it is doing damage to blood vessels.
Sandpaper is a great illustration.
Yeah.
Wow.
Yeah. So direct blood damage, direct blood vessel damage, rather. And when you damage blood vessels, it restricts how much blood flow is getting to tissues. And some tissues are very, very sensitive to blood flow changes. Do you know what kind of tissues are very sensitive to even the smallest amount of blood flow in impediment?
I could guess, but I'm going to let you tell me.
Nerves.
Nerves.
Yeah.
I was going to say it gets down to nerve damage.
It does. Yes,
So-
exactly. And
So,
nerve.
ding, ding, ding.
Yeah, you're exactly right. Nerves are super, super sensitive to blood flow changes. And that blood flow damage does cause oxidative stress, creates chronic inflammation, and that directly leads to nerve dysfunction, which is why diabetic retinopathy and diabetic neuropathy are major complications and issues that go along with diabetes. But also, if you're damaging blood vessels, you start to lose integrity of other tissues like the skin. And so if we are talking about areas that don't get much blood flow, like the feet, that's where you see people start to get wounds that won't heal.
Wounds and lack of feeling,
Like a feeling,
pins
exactly.
and needles,
Yep.
all that sort of thing.
Burning feelings. Yep. Yes, absolutely. So that all happens along with blood flow damage, blood vessel damage, blood flow changes. And this can lead to cardiovascular disease as well. I mean, there's just a whole host of things. Think about it. If you have sandpaper circulating in your bloodstream, it's reaching everything,
Right.
even the brain.
Wow.
So, and that's a topic for a different day. We've talked about that one before. But essentially, controlling diabetes is really important. So if you're hearing this and you're having issues with blood sugar control, I'm not telling you need to wait to go see somebody who does laser therapy. You need to go get that under control right now,
Right.
immediately.
Don't delay.
Don't delay. Get it under control. It doesn't matter how. Medications, nutrition, exercise, do it all. Because the longer it goes untreated, the more damage you're going to have and the less likely you are to be able to have that damage repaired. So,
Wow.
yes.
Is there any positive now?
No, it's all sadness. No, there's a lot of positive.
No,
Okay.
I'm kidding.
So that is how
It's just so important.
It
People
is. It
need to
is.
take care of their health.
yes.
I mean, we're not trying to get people to live forever, but we're trying to enjoy the life you have now.
Yeah, and that is the thing. I had a patient just very recently who said, "Well, I'm not going to take the medications that I'm going to take. I'll just die early." And I said, "That's not it.
No.
You don't get that choice. You may suffer for years with no quality of life if you don't take care of this now." And I'm not saying everybody has to be on meds. I'm not saying everybody has to be, starting a medication, being on it forever. But I am saying you can start exercising now and you should do that forever. You should start eating right now and you should do that forever. That's the way that goes. And maybe medications are a part of what you need to control this.
But try it in a step pattern. You know, do something, and then if you have to add something different later, do that. But let's just start.
Right. Start something. And that is going to be, very clearly I want to say you should be seeing a licensed qualified specialist for diabetes management, or a very good primary care doctor who pays good attention to you. And if you're not happy with your doctor, find a new one. But this is important stuff. It matters for the rest of your life.
Right.
So the thing with poorly controlled diabetes is you get these big rises and falls, right? And so if you have really high blood sugar, you're sandpapering your vessels, right? And if you have really low blood sugar, nothing's working right and you feel terrible. So you need to be properly managed.
That image is not going to get out of my brain now.
Good. I hope it sticks with everybody because
Yes.
it's really important to have properly controlled blood sugars. It doesn't matter how great laser therapy is. If your blood sugars are all over the place, it does not work.
Right. It's not a cure-all. It's not even a cure. It helps manage.
Right, exactly. So when it comes to all these different things that go along with diabetes, we're going to talk about wounds. We're going to talk about neuropathy. We're going to talk about blood sugar management improvements with laser, and we're going to talk about diabetic retinopathy and a little bit more too. So essentially, when it comes to wounds, if you can improve blood flow to the wounds, they tend to heal. Right. So, the wounds are really a complication of that impaired circulation. We know that laser therapy directly increases blood flow. It also enhances the formation of new blood vessels, which is called angiogenesis. So not only are you getting more blood flow to the areas that already have blood flow, but you're helping the body actually build in new blood supplies to those wounded areas. Nice. We also have some evidence that laser therapy improves collagen production in wound beds, improves fibroblast activation, which is the cells that help to form fibrin, which is a huge part of connective tissue. And then also reducing the inflammatory cytokines, the cellular signalers for inflammation. So you're addressing so many factors with wounds by using laser therapy. And that's I think really important to note that it's not just one thing. It's not just, we'll get more blood flow. You're actually getting more blood vessels, and you're getting inflammatory control, and you're getting the activation of these proper cellular mediators that are important for actually healing.
So you're getting new blood.
Yeah.
You're recycling your own blood in a way.
Yeah, right. So if you have a vessel, you're going to get improved function of that vessel. But if you have an area that's been damaged and no longer has, it's no longer vascularized tissue, it's dying tissue, the body can actually build new blood vessels into those areas too. Nice. It's pretty cool.
It is.
In the article, they talk about the studies have shown faster wound closure, improved granulation tissue, better tissue oxygenation. Now, that's still not a replacement for good wound care. If you have poor wound care, then that's an uphill battle that you're fighting, and that's not okay. So you need good wound care, and you also can add laser therapy to that and proper glucose management. Nice. So that's wounds.
Yeah.
Wounds are rough, can be very, very difficult. And so laser therapy is a great way to add to the care plan. Now, for nerve pain and diabetic neuropathy, so we already talked burning, tingling, numbness, a lot of pain, especially at night. Something that a lot of people don't really consider is the balance and weakness that goes along with that too.
Right.
So those are all negative factors to diabetic neuropathy, which happens in the hands and the feet. The small, tiny nerves are the first ones to receive that kind of damage from changing blood flow. And again, laser therapy helps with microcirculation around those tiny nerve endings and helps them repair, reduces the oxidative stress or that sandpaper type effect. It also supports the energy production in those cells by supporting good mitochondrial activity and should enhance nerve regeneration. So you actually see improved nerve function, improved sensation, and less pain all at the same time when you have laser therapy as part of the treatment plan for diabetic neuropathy. Now, this is one that is very exciting, that is still very much an emerging area for research, but we actually are seeing direct effects on blood sugar and metabolism. Some studies are showing improved insulin sensitivity with effects on glucose uptake, inflammation, mitochondrial function, oxidative stress. So I've got my one other quote that I'll read you from the article directly here. They say that the laser therapy has been reported to have beneficial effects on glucose metabolism, including reducing inflammation, modulating oxidative stress, and improving mitochondrial function. Those things I just said, right? But they say these cellular processes are directly linked to enhanced insulin sensitivity and improved glycemic stability, both of which are critical targets in diabetes management. Notably, these effects may mitigate insulin resistance at the cellular level, particularly in skeletal muscle and adipose or fat tissue, which are pivotal sites of glucose uptake. Furthermore, laser therapy can indirectly influence glucose metabolism by promoting vascularization, stimulating mitochondrial biogenesis, and activating intracellular signaling cascades involved in insulin regulation. So, not just the circulation side, although that is important, but also improving the cell's response to insulin.
So would that mean technically or possibly people could get off their insulin?
Potentially. Or reduce the dose.
That's what I was looking for.
Yes.
Potential.
Yes. And so that is one little side note that I'll make that the researchers don't. And that's just because I've seen this in clinical practice. When you start seeing improvements in blood sugars, sometimes people's medications have to be changed because they need less.
Right.
I've seen that many times. So work with your physician on how to do that and make sure you're being monitored. If you're starting to get laser therapy, there's a good chance that systemically you're going to be healthier. And if you end up having episodes of low blood sugar, that can be very dangerous. So work with your physician on, hey, I need to be monitored a little more closely right now because I may be seeing some good improvements on this.
Nice.
There's 3 other areas we'll talk about briefly. One is diabetic retinopathy, which is damage to the retina of the eye with diabetes. They are starting to see some good results using non-invasive, safe laser and light therapy for that. Also for dental or periodontal disease, gum disease. Laser can actually help with reducing inflammation, improving healing, and helping with tissue regeneration in the gums. which can really help a lot of people if they're dealing with dental issues, tooth loss, and things like that, along with diabetes. And then also general circulation and vascular health. So that's the cardiovascular aspect we talked about, right? So nitric oxide release actually directly impacts vascular health. Improved endothelial function is something that's been shown too, and the endothelium is like tissue lining of the blood vessels.
Okay.
So it makes blood vessels more efficient,
Right.
more effective. And then enhanced oxygen delivery to the muscles, even the muscles of the heart. So we're looking at, laser therapy being a very unique pathway to addressing multiple issues with diabetes. And this is something that is completely safe.
Right.
It does not have any side effects. No specific adverse effects have been recorded.
Right.
You may have a little bit of fatigue or things like that.
So that would be pretty much it.
Yeah.
Fatigue.
Yeah. Usually
Then you bounce back.
You bounce back. It's like a post-workout fatigue kind of thing. Just kind of tired.
Just rehydrate.
Yep.
Get going.
That's exactly right. Yep. It's completely comfortable too. We're not talking about burning or cutting tissue. There sometimes is a little bit of warmth that goes along with the treatment. It's pretty mild, very comfortable, very easy to tolerate, even for kids. Now, the biggest thing here, and the researchers point this out, is that proper laser therapy protocols are critically important. And that means the right color of light, the right wavelength, the right kind of dose, the right kind of treatment timing. All these are things that need to be looked at by a laser therapy expert.
So you don't want to just go find a red light therapy device online.
Right. Yes. Which is easy to do nowadays, which I don't think is a bad thing.
No.
But if you're looking for results in these areas, just randomly throwing some uncertain amount of red light toward your body is probably not the best approach.
Well, you might not have the effects that we're really going to get with a different and specialized unit.
Right. Yes, there are specialized laser therapy devices that are for clinical use, and that is usually going to have the biggest effect. And I'm not saying don't get a red light unit for home. It can be great even just for skin health. But if you're looking for neuropathy improvement, if you're looking for some of these other things we talked about, cardiovascular changes, less likely to happen with just a generic red light device with uncertain specifications with no specific protocols.
Right.
So they say that, look, this is still a developing field. The protocols matter, but we do have evidence that it can be very good. They say to ensure safe and effective implementation of laser therapy, healthcare professionals must receive specialized training in laser physics, tissue interactions, and device operation. So that is not necessarily for you as a patient. That is for your doctor. Your doctor does need specific training. This is not something any of us get really trained on well in school.
Right.
Some physical therapists and chiropractors do get some little bit of training in this, but it is so brief and it is not specific to diabetes. So your doctor does need training. If they are looking for training, we here at LTI are the ones to give it. We have been doing this for many years. We have the protocols. We know about the devices. We can help your doc set up a successful program to be able to help. You can also look for an existing LTI clinic. If you just go to our website, lasertherapyinstitute.org, you can find a clinic near you. I would highly encourage you, if you are diabetic, to not only have good management, but to start looking into light therapy and laser therapy as a possible option to help your position.
Sounds great. This is exciting. It always
It is exciting.
Always is.
This is the first one of these studies I've seen where they covered multiple aspects of a disease. We've seen studies on diabetic neuropathy. We've seen studies on diabetic retinopathy. But this is the first one that kind of pulled it all together and said, look, there are massive effects you can have for somebody with diabetes simply through the use of light and laser therapy.
Right. And it's not going to be a quick fix.
That is true.
It does take time.
Yes, that's a very good point to make.
Time.
It's a very good point to make. Thank you, actually. As kind of a final point, don't do one session and expect massive changes in something that has taken years to develop. Right. It is going to take a few different sessions. It is going to take a little bit of time, especially when you're talking about changing nerves and improving and building new blood vessels. It's not happening overnight. We're not quite to that Star Trek level laser use yet, but a little bit slower. Yeah, it can work extremely well.
Yeah, really.
Thanks for joining us. We'll bring you some more research on the next episode.
Thanks.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.